Hello and welcome. Today we're diving deep into a specific type of kidney stone, Topiramate stones. These stones are a potential side effect of the medication Topiramate, commonly used to treat conditions like epilepsy and migraines. We'll explore what causes them, how they develop, how common they are, what symptoms to watch out for, how they're diagnosed, treated, and most importantly, how they can be prevented. The main culprit behind Topiramate stones is, unsurprisingly, the drug Topiramate itself. Topiramate, when metabolized, inhibits carbonic anhydrase, an enzyme critical for kidney function. This inhibition leads to decreased citrate excretion in the urine and increased urinary pH. Decreased citrate makes it easier for calcium to bind with other substances and form crystals, while the alkaline urine further promotes the precipitation of calcium phosphate, creating an environment ripe for stone formation. Genetics and pre-existing kidney conditions can also play a role, increasing an individual's susceptibility. Let's break down the pathophysiology. Topiramate acts on the kidneys, specifically impacting the transport of ions and affecting urinary pH. The reduced citrate excretion, a natural inhibitor of stone formation, is a key factor. Simultaneously, the rise in urinary pH allows calcium phosphate to crystallize more readily. These crystals then aggregate and grow, forming stones that can lodge within the kidneys, ureters, or bladder. The size and location of the stone will greatly affect the severity of symptoms experienced. While precise epidemiological data specific to Topiramate stones is limited, we know that kidney stones in general affect a significant portion of the population. Individuals taking Topiramate, particularly at higher doses and for extended periods, are at a higher risk of developing these stones compared to the general population. Studies suggest that the incidence can range from 1.5% to 10% in Topiramate users, but the exact number can vary depending on the study population and duration of Topiramate use. It is imperative for prescribing doctors to be aware of this elevated risk and counsel their patients accordingly. The signs and symptoms of Topiramate stones are similar to those of other types of kidney stones. The most common symptom is intense pain, often referred to as renal colic. This pain typically starts in the flank or back and can radiate to the groin or lower abdomen. Other symptoms may include nausea, vomiting, blood in the urine as hematuria, frequent urination, painful urination set dysuria, and in severe cases, infection with fever and chills. The intensity and nature of these symptoms can vary depending on the size and location of the stone. Diagnosing Topiramate stones involves a combination of patient history, physical examination, and imaging studies. A detailed account of the patient's medical history, including medication use, is crucial. A urine analysis can reveal the presence of blood, crystals, and signs of infection. Imaging techniques, such as a CT scan without contrast and CCT, are the gold standard for identifying the size, location, and composition of the stone, and ultrasound may also be used, particularly in pregnant women or individuals who cannot undergo CT scans. Rays, specifically a KUBISA kidneys, ureters, bladder X-ray can be useful but are less sensitive than CT scans. While we don't classify Topiramate stones into distinct types, in the same way we do with calcium oxalate or uric acid stones, it's important to recognize that they are primarily composed of calcium phosphate, due to the alkaline urinary environment created by Topiramate. Understanding this composition is crucial for guiding treatment and preventive strategies. Treatment for Topiramate stones depends on the size, location, and severity of symptoms. Small stones may pass spontaneously with increased fluid intake and pain medication. Alpha blockers like tamsulosin can also be prescribed to help relax the ureter and facilitate stone passage. For larger stones or those causing significant obstruction or infection, more invasive procedures may be necessary. These include extracorporeal shock wave lithotripsy, uroscopy with laser lithotripsy, or percutaneous nephrolithotomies at PCNL. The choice of procedure depends on several factors, including stone size, location, and patient factors. Prevention is key in managing Topiramate stone risk. The most important preventative measure is adequate hydration, aiming for a urine output of at least 2 liters per day. Monitoring urine pH and citrate levels can help guide management. Potassium citrate supplementation may be prescribed to increase urinary citrate levels and make the urine less acidic. In some cases, if clinically appropriate and after careful consideration with the prescribing doctor, a reduction in Topiramate dosage or alternative medication may be explored. Regular follow-up with a healthcare professional is essential to monitor for stone recurrence. The prognosis for individuals with Topiramate stones is generally good with appropriate management. However, recurrence is possible, especially if preventative measures are not followed. Recent research has focused on the development of more targeted therapies to address the underlying mechanisms of stone formation in Topiramate users. Studies are exploring the potential of specific dietary modifications and novel medications to further reduce the risk of stone formation. Long-term follow-up and adherence to preventative strategies are crucial for maintaining kidney health and minimizing the risk of recurrence. Thank you for joining us in learning about Topiramate stones. Remember, early detection and proactive management are crucial for optimal outcomes.